Hello guys, my name is Yashdeep Thorat. Today we discuss the topic of the minimum criteria for reporting ADR in PV. Pharmacovigilance is the science and activities relating to the detection, assessment, understanding and prevention of adverse effects or any other drug related problem. All medicines and vaccines undergo testing for safety and efficacy through a clinical trials before use. Pharmacovigilance has four main terms. The first is the detection. In the detection, in the case of a clinical trial, it is the investigator, or in the case of a post marketing trials, the physician, the prescriber, or the patient himself who report the adverse event or any other drug related problems. Now the second is the assessment. The healthcare professionals HCP would access if the adverse event or drug related problem is due to the drug or is due to some other reasons. Third one is the understanding. The reporter and a safety specialist are involved in understanding the adverse event or drug related problems. Fourth is the preventions by proactively reporting the adverse event or drug related problems to the regulatory authority and taking precautionary action would help prevent adverse event in the future. Now the aim and scope. First, to improve patient care and safety about medicine and all medical and paramedical intervention. Second, to improve public health and safety about the use of medicine. Third, to contribute to the assessment of the benefits, harm, effectiveness, and risk of medicines. Fourth is to promote understanding clinical training and effective communication to health professionals and the public. And now the objectives of pharmacovigilance. The objective of pharmacovigilance is the reduction of the frequency and the severity of adverse effect of a drug while maintaining or better improving their efficacy. Now, why pharmacovigilance? First is the humanitarian concern. Second is safe use of a medicine. And third is the ADR are expensive. And fourth, promoting rotational use of medicines. And fifth is the ensuring public confidence. Sixth, the ethical concern. And now the minimum criteria for reporting an adverse drug reaction in a pharmacovigilance are first is the identifiable patient. The patient's name, age, sex, and relevant medical history should be included. Now, identifiable reporter, the name and contact information of the healthcare professional or individual reporting the ADR. The suspect medicinal product, the name and doses of the medication suspect of causing the ADR. Now the adverse reactions, a clear description of the symptoms, signs and severity of the ADR. Now the suspected causal relationship, a statement indicating the suspected relationship between the medications and the ADR. Additional information that may be helpful in assessing the ADR includes now the concomitant medications, a list of other medications the patient is taking, medical history, any relevant medical conditions the patient may have, outcomes, the outcomes of ADR including any treatment provided and the patient's recovery. It is important to note that these are minimum criteria and additional information may be required depending on the specific circumstance of ADR For example, if the ADR is serious or unexpected, more detailed information may be needed. The specific requirements for ADR reporting may vary by country and regulatory authority. It is important to consult the relevant guidelines and regulations to ensure that all necessary information is included in the report. So guys, this is the topic of a minimum criteria of pharmacovigilance. Thank you.